how do you diagnose and treat the endometrial cancer?
Endometrial cancer is seen in the midline old age group. So symptoms of endometrial cancer, symptoms or signs are like bleeding in between the menstruation, irregular erratic menstruation. Patient will be complaining like from last 4 months or 5 months, I'm having weekly bleeding, or it is uncontrolled. I mean, it is not regular, cycles are not there, and the quantity is more. These are the usual symptoms of endometrial cancer. And the obesity is a risk factor for endometrial cancer. Patients who are obese are more prone for endometrial cancer. And other than this, patient might be detected on a screening pap smear done for cervical cancer. Sometimes the cells can be shed and can be detected in the pap smear. That way also we can detect. These are the ways endometrial cancer presents. Later stages, it might present with the pain, low backache, spread to the other parts of the body like bone, everything else. So the specific to endometrial cancer, these are the symptoms. Coming to the treatment part, generally the disease is limited to the uterus and it is not invaded too much into the uterine wall. Surgery would be the adequate treatment. If surgery is complete and there is no spread to the side nodules of the abdomen on either side of the uterus, and if it is not very deep in the uterus, these can be treated only with surgery. But if the invasion is more, that is if it is going in deep into the uterus tissue, these cases treatment of alone surgery would not be sufficient. In these cases, patient will require additional radiotherapy in the form of brachytherapy or in the form of external beam radiotherapy. That is where we give radiation from the outside. Brachytherapy is wherein we given intravaginally radiation therapy is given, wherein radioactive source is kept inside the vagina, and that will give clearance of the disease or residual tumors, so that to help in the prevention of the recurrence of the endometrial cancer.